this is Reese from Polk County Public Health. It is Thursday, October 1st, and I'm here to give you a COVID update. Welcome to October. Thanks for being with us. Today we're going to take a moment to talk about the COVID decision tree. You may have heard that school districts across Minnesota, including Polk County, are utilizing the decision tree to help to determine if students or staff are having symptoms consistent with COVID-19 and to provide additional guidance on what are the next steps. One of the things that I would like to talk about today is what to do if someone has one more common symptom or at least two less common symptoms. I'm really proud of the state of Minnesota for taking a deep dive and to look at the research, to talk with medical providers, talk with epidemiologists, and to make decisions about what is considered a more or less common symptom in terms of school, students, and staff. So with this guidance in mind, I want to just look at this middle area right here, which is about if folks are experiencing one of the more common symptoms or two of the less common symptoms, and so that they would either stay home or be sent home if they were experiencing those symptoms while in school. There are three ways to return to school, and that's what I'd like to visit about today. So the first way that they may return to school is with a negative COVID test. The second way is with an alternative diagnosis, so seeing a medical provider and being assessed for their situation to determine, in fact, if there's a different disease process that's taking place, and so an alternative diagnosis can be given. And then the third way is if there is no negative COVID test and there is no alternative diagnosis given, the third way is for that individual to stay at home and separate themselves from others for at least 10 days from the time that their symptoms began, also making sure that their symptoms are resolving before they would come back to work or school, and making sure that there's been at least 24 hours where they have been fever-free. So one of these three ways are how individuals, whether they're a staff member of the school or a student, can return to school. We all want everyone to stay in school, and we want students to receive the best education that we can, and so we are working together to ensure that when people come to school, they are safe and healthy for us all. We appreciate all that you are doing to help kids and families remain in school and receive a great education. Thank you.